It's an unofficial Happy New Year on your Feel Good Breakfast Show as we're celebrating the 2nd of February on your live show this morning. Well, you can give us a call on 0839133728 if you want to talk about meningitis, because that's our topic for this morning. An outbreak in the Western Cape, and doctors putting our fears at ease this morning. Dr. Darren Green in our studio. During the break, we were talking about symptoms. How do you find these symptoms in a baby? I mean, all of us are stressing at home, thinking, we don't want this.
Correct. It's like treating an animal or a dog, for example, that can't tell you what's wrong with them.
Right.
So the fever you'll pick up, your child might just be irritable, not eating properly, look a bit weaker, and their temperament and behavior pattern might change. That's when you know you should have them at least examined from head to toe, looking at the ears, looking at the throat, listening to the lungs, etc. But when you check the temperature, obviously you'll find the temperature is raised. You'll also find skin rashes on your children. If you're not sure about a skin rash, please go and see someone about it, especially if it's purple and blue and your child has blotches or patches with the fever and so on. You want to make sure that the virus or the bacteria that's infecting the bloodstream is not obviously multiplying at such a rate that it's overcoming your child's immune system. And that's when we need to intervene.
When it's diagnosed that you do now have meningitis, how is it treated?
So we diagnose this by doing a lumbar puncture.
What is a lumbar puncture?
A lumbar puncture is when we remove cerebrospinal fluid. So the brain and the spinal cord are bathed in a see-through transparent fluid that keeps it moist and nourishes it, etc. We extract that by inserting a needle after some local anesthetic at the lumbar area. That's now the arm that they're showing you there, but between the vertebrae there's a space that we'll extract some fluid that's sent to the lab for test. And we look at which type of cells are raised and present in that fluid to make a conclusive diagnosis of which type of meningitis you have. We then treat according to the bacterial type or the viral type or even the fungal type. And obviously even things in the Western Cape, TB meningitis is rife, and the complications of meningitis are the things we want to steer clear of and prevent.
What is given to the patient? I mean, I'm just thinking, how long does it last? Is it like a cold eventually that is just a lot more dangerous?
You mean medication-wise?
Yeah.
So we give them antibiotics if it's a bacterial meningitis. Often, if someone comes in really sick, while we're even waiting to do the lumbar puncture and they're looking as if it's touch and go, we start them on bacterial meningitis treatment, and then we stop it once we have a diagnosis. And then basically we follow them up. Often serial lumbar punctures are needed. You treat them symptomatically for fever control, etc. They're often hospitalized to make sure that they don't develop the systemic complications. I mean, deafness, loss of hearing, learning disabilities, epilepsy, scar tissue on the surface of the brain. Those are all the things that can result from meningitis.
0839133728 if you want to give us a call this morning. We are live with Rosemary. Rosemary, you are live on your Feel Good Breakfast Show. Good morning.
Morning, how are you?
Very good. How are you this morning?
Very well, thanks for asking. I have a question for Dr. Green.
Sure.
Morning.
I'm 29, and then I conceived my son when I was 25. So now ever since my son was born, I've had this headache constantly for 5 years, and then I'd be admitted in hospital, and every year a lumbar puncture would be done. So now I'd like to find out, and the rarest thing about the headache that I have is that I have them every year, almost at the same time. I know that around July, August, I'd have to be admitted in hospital for the same thing. So now I'd like to find out what is the cause of it.
Okay, Rosemary, really sorry to hear, but perhaps doctor can help us.
Yeah, and certainly lumbar punctures are not, they are feared, but certainly it's a quick procedure, but it is a bit painful for many people, and often afterwards they have a bit of pain. So the headaches she describes are seasonal headaches, typically in February. Often there's an association with weather patterns, with allergy-triggered headaches, obviously with sinusitis and so forth as well, the heat waves, dehydration headaches, etc. So a headache itself is such a broad symptom of so many conditions medically that I would recommend that she actually sees a good neurologist that will go through the headache in detail, with a good history, monitor. She'll keep a headache diary, for example, analyze the character, the site of the headache, how it spreads, the associated symptoms, and then we'll take it from there. Obviously, in a young person, her age, between 25 and 29, with persistent headaches, I always recommend imaging, that we can have a look at the brain and make sure that structurally there's nothing causing the headache. And once that's done, often the patient breathes a big sigh of relief as well, and then we can look at the other triggers.
It's so crazy, Rosemary, and we really feel with you this morning. We know
Indeed.
It's not meningitis, and the good advice there.
Good
Thank
news.
you so much, Doctor. There's loads more happening on your show, and we're going to urge you to keep calling us, 0839133728. We're talking meningitis this morning, but a whole lot of other stuff. Ewan, over to you.